previously, and when there was no idea about the palliative care, most of the patients died with the suffering, lots of suffering, and their symptoms were poorly managed.
Even sometimes the people have died in the course of treatment in the hospital itself, and there was a dreadful deaths we have seen.
रोग निको जी रोग खाए मखाए होला तर वो गु बाइर पेन ज्यादा दुनी स्याउ वो स्याउ रे वो थमा तने वो न्यानु से मखाए मा वो कम जी मा ताइ जी वो उपचार अब वो जो उपचार ला निको जी उपचार ला खाए मखाए होला अब मोजो बाखे तने उडा स्याउ तने मसाय मा रे किस्म नि जिमो वो से चाहे मसाय म उपचार वो मसाय से जो उडा आनन्द जी मा.
When I was in a medical school, I used to see how the patients are treated and how they are cared of. And I always used to think, can't we do something better?
So I went along with Stuart Brown and Fraser Black and a few other people, and we helped out with a few lectures in Kathmandu and visited a number of beginning palliative care programs in Nepal, Hospice Nepal in Kathmandu, and it was a very interesting experience for me. It was my first chance to work in a situation like that. There were some very interesting things that really struck me and made me think for a long time after I came home. One of the issues in particular was seeing the patients who had pretty difficult symptom issues, pain and nausea, other symptoms, and recognizing that there were good solutions to these problems, but they simply couldn't afford them. One particular example was a man who had very difficult and persistent nausea and vomiting, and we asked whether they had tried a simple drug like haloperidol, which we knew was available and we knew was quite inexpensive. And they commented that the patient and his family couldn't afford the medication. So we asked how much the medication cost, and there was a pharmacist in the group, and they conferred with the pharmacist, and he said the medication would cost 5 cents. So it was really a surprise to realize that when they would say this family has no money, they really meant this family has absolutely no money. So when I came home, I told that story to a number of people, including my wife Deirdre and some of the nurses in the palliative care unit, and the common response of everybody was, well, we have to do something.